see the environment and help her. And I don't know if they use conscious discipline, but I hear her use the word in French, you know. And so I don't know if it's conscious discipline or whatever they call it, but you know, they are really proactive in that sense, you know. And she goes to some specific meetings with other foster parents. It used to be every Monday, you know, at a certain point. When I go back, I will ask her more, so I can, in a way, compare in my head, you know, how the systems function. But just to go back to what I was saying, it seems like there is something in the way they put out their policies over there that make parents feel okay to talk about personal things, knowing that they're going to be helped and not judged. What you were exactly saying, you know. And I know the agency wants to help, but how can we, you know, convey that to them and say, okay, it's okay to do that because we are not judging you. So I don't know.
It's a trust issue.
It's a trust issue.
I think it's I think you're absolutely right. The process. I'm a foster parent on the Kansas side, so what you described is very much what we went through to become foster parents. We're working, you know, here with foster parents on the Missouri side, and I know that there's historically been a great amount of tension between the court systems, foster parents, and child welfare. It's been a very strong triangle, and that stems from, I don't know, things that happened before I even became a social worker, but have changed, I believe, systematically in the last 10 years. But I think there's still some of that historical trauma, and I think it's changing. But I think that, like, systems and decisions that were made, I know that on this side of the state, they had to work really hard to have a foster parent bill of rights so that they were seen as part of the treatment team and privy to information, that wasn't their history. So I think, to a certain extent, some of this is historical trauma as a foster parent that causes our challenge here. We did make a modification. We went to the short form, which is actually the one you're looking at. The short form gives us a measure of parenting stress. It doesn't divide it into the two categories. Is it the kiddo? Is it the, which doesn't help us in the clinical determination, but it does give us an overall, how stressed out are these families. But even with that, we're only using it for the Parenting Support Services program. We're only, it's not for every child that comes into the program. It's only if that parent's engaged in a service with Rhonda or Jamie.
I see.
And we're using it more to evaluate how did they score before the service started, so a pre-post test measure of their stress level after they've had parenting support. So we like the tool, we think it's valuable, but we had, it just became, why are we asking parents to fill out more questions if we're not using the data? That doesn't seem good for parents. It's more time, it's more scoring, it's more. So that was a real interesting story, and what we thought was going to be great wasn't, and then we just pruned it back because it was not helpful and taking more time.
Well, you know, there was something that came to my mind while you were talking about those woodblocks with your parents. I remember when I was an early childhood educator, the school, one of the schools where I work in Haiti, they decided to have like what you call here parent teachers, you know, conferences. But the way they did it, it was like in at two levels. First, the parent could come and discuss with the teacher, you know, how the child was like doing after we wrote a little evaluation note card. But also there was something that I really like, because I like to lecture, you know, in a positive way. So parents would come once, you know, every 3 months, and we will have like you know, a discussion. So some of them will tell us, you know, ahead of time, like, oh, I'm glad we're going to have that discussion because I'm having that kind of issue at home, that kind of stuff. And we'll take mental notes and we will brainstorm among ourselves, and we will have somebody come to lecture, you know, about that particular issue. So, and over time, you know, whatever bad feelings the parents had or whatever misfit was happening, you know, in the home, so it would be addressed. And we were, very careful back home in Haiti not to do it ourselves because we didn't want the parents to feel that, oh, because I told you what's happening with me, so now you are lecturing me directly. You know what I mean? Because Haitian parents can be very sensitive. So if it's somebody from X university or, some other personality that comes, so it's so neutral that that person talks to everybody, So I don't know, because over there, we just do the best we can. We mostly did it. I think it was over the weekend at a time that was more or less suitable for the highest percentage. But there was no grant involved. Haiti is a small country, but I'm just sharing that with you to see if this is something that agency may consider to help build that trust.
Right.
Because the same way we're having those staff meetings, so maybe like a parent meeting for the day treatment program at a time that would be suitable. Because I know that there are activities at the Winter Wonderland, for example, and you give them pizza or whatever. So can there be like a training component into it? But not in a way to say that, okay, you bad, and you know what I mean, but in a positive way. So something maybe to think about,
And we had a really neat program going, and it was it would happen on Wednesdays. So the parents would come about 10:30, and we would do a conscious discipline training activity until like 11:15. And so it was just the parents, and it was Jamie's predecessor, the woman that did that, and Rhonda. So they would teach, and then they bring the child down into the room, and then the parents would do the ritual or whatever was learned with the child. So then there would be kind of 10 minutes of kind of that relationship building between the grown-up and the child, practicing a new skill, and then they could be coached. And then they serve lunch. So then the child ate their lunch down there with the parents, so they got to eat together, as a community. And then they all went home at noon.
So what happened?
Attendance. It just dwindled. So you were, probably the most we had was maybe 4 or 5 at one point.
I see.
And then it dwindled down to, nobody would come or one would come. And I think that was really frustrating from the people that work so hard to put it together. And again, life happens, and not everybody is free at Wednesday mornings. Lots of people work. We were trying to make it fit with when the kids were here, so we could have that.
Fit the parent schedule. I see.
And we did surveys. Every Winter Wonderland we've asked, please fill out what times you could come. That's how we determined when to do the focus group. That went into the. So we asked the current population, because that's always changing.
Yes.
What was the common time that people could come, and so we tried to recognize that. But I think that's what. And then Janelle left, and that's been something. I think that we need to put some work into what parenting services means. Getting them here is always.
Yeah.
They love it once they're here, but it's that
the continuing
process of stopping whatever I'm doing and coming that seems to be a barrier.
Well, I'm so glad that we could have that candid, conversation, because I had, I talked to a lot of, colleagues, but I was really struck by something that either Katie or Amanda wrote in one of the papers that showed me. There was a wonderful sentence about a holistic way, because I'm really about holistic, interventions, to make sure that, everything that we're doing here, is understood by the parents, and they're really part of it. So that's why, I really value that you are concerned by, that aspect also, how parents can be more involved. And if there is anything I can do, because the next semester, the purpose of that paper is to develop a capstone project.
Right.
And I don't know yet what it's going to be, but I will definitely share it with you when I start classes in January, and Krista as well, to see, based on all those limitations, quote unquote, that we talk about, if there is anything, that I can be part of for the remaining of the year, to help start, getting that off the ground.
Again, I think that would be a perfect place to put your energy as parent or caregiver, because it's not whoever cares for a child. engagement,
Okay.
what that needs to look like. I think we've made great inroads. There's more opportunities than there were when I started. Even the Winter Wonderland, the field day, the staffings, daily notes every day. The contact with the therapist has increased. I think we've made a lot more progress in creating those relationships, but there's not a parent education component to it outside of what Jamie and Rhonda do.
Okay.
And so I think that's a space
that's something we could maybe explore more and see how we could make some improvements.
And I think it'd be curious to think about it. Could we deliver it electronically? Could we do a webinar? So people don't even physically have to come here. But do people have the technology that allows them to do it? Can they do it off their phone? Everybody has phones, I've learned. So it's how do we get there?
How we can catch up with technology and the hurdles of life
and meet the family needs.
Meet the family needs.
What would be really fascinating, and I don't know if this can happen, is Winter Wonderland. In December is a space where you're going to have 20 families.
When is it?
The 14th of December.
The 14th. Is it a Thursday?
Wednesday.
Okay, I'll be here. Because although technically we'll be on Christmas break, but usually I work the week after because classes are going to be done the 8th or something. But the following week I usually go to my practicums if I need to get some more hours or something. And so that's perfect. So that would give me a chance to see and take some mental notes and, see, maybe we have, I'm not saying that, create like another survey, but have like some key questions that, since they like phone conversations, maybe find a time to call these people and ask them, what they would like. Because I was taking mental notes yesterday when you say that, it seems like the daily notes, they would rather have somebody talk to them over the phone, So, yeah. So it's okay, I could go in that.
Oh, yes.
Yeah. Okay.
But I think probably you and Carrie need to get together even before then to think about the focus group. Because
Carrie Zelmer. Yes.
And think about doing a questionnaire around what are the good times. Like I said, we've always asked what day of the week would be best. Would you be interested in? And we put their name on a list. So we call those families first when it's time to schedule a focus group. And then what times would be best for you. So then we look at where the majority of the group is. And so we know that they've already been introduced to the concept. So when we call them in January to schedule, they're like, I remember that.
Yeah.
So I think there really is some work. But you could think about, are there questions we need to ask in the focus group that help us create this program, or are there questions we ask in that first survey that help us create a parent education? So it's time to be thinking, because you only get in front of them a couple times a year.
Yes.
So, we can make a space to talk about those things during that Winter Wonderland meeting.
Okay. And since we mentioned the webinar, so maybe there should be a question about computer access, and see if a lot of them have it, and based on the time they have, so how they can, watch a video, maybe a YouTube video or something like that, So I'm so excited because, that's why I love this place so much. I am using both of my skills,
right.
The educational skills and also, the social work skills,
right. Me too.
Yeah, it feels good. Being able to work with the kids and also help the parents.
Yes.
Yeah. Okay.
And that's what I think we're supposed to be doing.
Yeah. Is there anything else?
I don't know. You take a look.
Let's see. Well, I don't know. That organization driver things. This is the part, honestly, none of us were clear,
Yeah, I'm like, those are not terms I'm completely...
Yeah, so, I think what Dr. Bertram was trying to ask us is for the facilitative administration, for example, and system level intervention, to us it seems like it was linked, with the organigram that you have, the people who are supervisors, the people who are coaching, and then, how is this set up so people don't just do whatever they want, not that they are, but how is it done so that you can have the competency drivers.
Right.
And in a way I have the answer, because I know, for example, for the therapist, Cheryl is a supervisor, and she makes sure that the therapists they get their caseload, and then we have all those wonderful meetings every week